LoveMyBody is dedicated to promoting positive body images and combating eating disorders and obesity within minority and multiracial communities. It's a show about real challenges facing real people like you and like me. I'm your host, June Evans, and today we're going to talk about lifestyle management and managing your life with diabetes. Today I have with me my esteemed guest, registered nurse and diabetes educator, Sheldon-Rubio Sheldon. But before we get into Michelle, I really want to go ahead and let our listeners know a little bit about something that's going on that you may be able to participate in. One of our partners, Heart and Soul, wanted us to let everyone know that right now there is a study going on with weight control. So if you've lost more than 30 pounds and have kept the weight off for at least 5 years, you can participate in this study. A lot of people have registered for this study, but African Americans have not been represented well. So we encourage that African Americans go on. You can call. It's the Weight Control and Diabetes Research Center at the Miriam Hospital, Brown Medical School, and you can call at 1-877-371-5483, or you can log on to www.nwcr.ws. So now we're going to go back. I'm going to actually have my guest give me some background. I want you to hear about her wealth of knowledge with diabetes. I really find that to be fascinating. You really don't hear a lot about people who are just well versed in diabetes for as many years that you've been involved in it. So tell me a little bit about your history with diabetes education.
Well, thank you. I appreciate those accolades. My name, first of all, is Michelle Sheldon-Rubio. And I've been a registered nurse and a diabetes educator for more than 25 years. My interest was really piqued in diabetes when I got involved in research in the 1980s with an implantable insulin pump at the Johns Hopkins Medical Institution. And I think that was when, something went off in my head. I was always interested in chronic disease, but diabetes seemed to be where the edge was, because diabetes, and as we talk a little bit more, is a lot about relationship because it's a chronic ailment. As I said, I've been in diabetes for over 25 years. I'm very active in the field of teaching and in diabetes management, self-management. I'm a member of the American Association of Diabetes Educators, which is a group of professionals, be them doctors, nurses, registered dietitians, and so forth, who come together as a professional organization to talk about and to establish guidelines for educating patients with diabetes. And I've been on the board there, the board of directors, for over 3 years. And also I'm an active member of the American Diabetes Association as well. And I serve as a consultant for several pharmaceutical companies and educational filming and so forth.
Oh, excellent. We kind of assume that everyone knows about diabetes. 9 times out of 10, you know someone who knows someone who has diabetes.
Absolutely.
But I want you to really give an explanation of what is diabetes. What is it?
Well, it's a disease that's been around since the beginning of time, believe it or not. Diabetes mellitus is the proper name for diabetes, and it means siphoning of honey, is what the full name of diabetes means. And what that is because in the beginning, when people first looked at people who had diabetes, there were people who exhibited many, many symptoms. And the symptom that was most pronounced was increased urination, which is one of the ways that a person knows that their glucose levels are high. You also have a large amount of glucose or sugar in the urine. So way back when, before we had laboratories, the way to test and whether a person had diabetes or not was to either taste the urine of a person who exhibited the symptoms, or as time went by, to put some of the urine onto an anthill and all the ants would come forth, meaning it had a lot of sugar in it, or leaving it out in the sun for a while, it would dry up and you could actually see the sugar crystals in it.
We were talking before the show began, some of the myths that tend to go with our culture, and we, some people say, "Oh, I have a little bit of sugar." Is that where they get that from?
That's where they get it from. They're not just having a little bit of sugar, it's a whole lot of sugar. And that's actually where the name comes from. It's actually siphoning of honey, which means that's the way the body gets rid of the enormous amount of sugar that's built up in the bloodstream, since insulin is not working properly and the body is resisting the insulin action, or you may not be making enough insulin. That's the whole essence of what diabetes is.
So now there are different types of diabetes. Explain to us the different types and, you know, how they differ and things like that.
Okay. Well, I'll give you the large categories, because there are a lot of subcategories, and research has flushed that out over the years, that there are a lot of subcategories. But the major categories are type 1, which is the kind of diabetes that people used to call juvenile diabetes. It's the type of diabetes where a person does not make insulin. Why? Because the insulin-producing cells of the pancreas are killed off. We call it an autoimmune dysfunction. It's very genetically related. Lots of times we used to call it the kind of diabetes seen in people who are younger than the age of 20. But we found that that's not true anymore. We can see type 1 diabetes happening in people over 50. The other major type of diabetes is type 2. Type 2 diabetes is the diabetes that they used to call adult onset, usually seen in adults over the age of 40. And what we found that was really prevalent in this type of diabetes is people do make insulin, but the timing of the secretion of insulin is not what it should be. They may not make enough of the insulin, and once the insulin is out there circulating in the body resists the insulin action. So that's type 2, the second big category. There is a genetic relationship with that, in that you see it happening in cohorts of families. You also see it in cohorts ethnically. And that's the type of diabetes where, when you look at the African American population, we are affected by that. Thirdly, believe it or not, because on the top of the list is the American Indian or Native American, secondly Hispanic Americans, thirdly is the African American, and fourthly is Asian Americans. So those are the affected ethnic groups and how it falls in sequence. 90 to 95% of people with diabetes have this type of diabetes. The third type of diabetes is gestational. Now, this is the only diabetes that you actually can get rid of. And how you get rid of it is to get rid of the baby.
Right. So that's
you
the
deliver the baby.
That's the type of diabetes you can develop when you're pregnant.
When you're pregnant.
Okay.
And it has a lot to do, again, with genetic predisposition. People in the family cohort somewhere probably have diabetes. The babies are usually very, very big at birth with people with this type of diabetes. But the really bad thing about this diabetes is people think you get rid of it, and you do with the birth of the baby. But if you don't reverse what is the causative factor, which is just not the baby, but if you don't keep your weight under control, you don't eat properly, you don't exercise, generally in about 4 or 5 years after that delivery, if you don't change some of your habits, you can develop type 2 diabetes.
Really?
So it's a precursor for that.
I've never heard of that. I really did assume that it was just something that occurred when you were pregnant.
It is.
And once the pregnancy was over, it was done with. So what you're saying is that if you do develop gestational diabetes, there's it's almost like a preset that you're prone to developing diabetes. So you really do need to manage your lifestyle so that you will not.
Absolutely. Because diabetes just doesn't happen out of the clear blue sky. Sometimes it does. And type 1 happens very acutely, in that a person gets very, very ill, they start exhibiting the signs of high blood sugar, and usually they're treated right away. But in type 2, it's very, very subtle. A person could have pre-diabetes. That means your glucoses are not exactly where they need to be diagnosed with diabetes. But you have a higher risk if you don't change some of the things that are the driving force of you moving toward frank diabetes, which is lifestyle practices, weight, managing what you eat, activity. All of these things are important. So when people ask me, well, what's the treatment for prediabetes? The treatment for prediabetes is the same treatment for diabetes. Management. And management is all about lifestyle.
Well, that's why it's important to know that it is a lifestyle change, and it's something that we probably should all incorporate.
Absolutely.
Well, now tell me, what are some of the dangers and complications once you develop diabetes?
Once you develop diabetes, the sky's the limit, because diabetes is a disease that happens in the bloodstream. So that means everywhere the abnormal blood travels is going to be changed by exposure. So it's really important to understand that first. So where does blood circulate? Throughout the body. So the vessels are the first thing that are going to be damaged long term if you don't change the thickness of the blood. Now, you may not be able to see this, but you'll be able to see it close up. This is what your blood would normally look like. All right? It's like a glass of water, not really thick.
Nice and
everything's
slow.
moving around.
Really.
Okay, now tilt this.
Oh, wow.
The difference between concentrated and diluted. That's the difference between a person with and without diabetes. Now, what will happen to the tiny, tiny vessels that are exposed to this very, very thick blood? They're going to be torn on the inside. They're going to be damaged. Just like a sword is being rubbed and rubbed and rubbed and rubbed and rubbed. The same thing would happen in the ocean. If you have the ocean splashing against rock and come back about 15 or 20 years later, what's going to happen to that rock? It's going to be worn away. That's the same thing that happens inside of your blood vessels. So if that vessel happens to lead to the brain, by and by, you can rupture that vessel and you can end up having a stroke. If that vessel leads to the heart, you could rupture that vessel, and so wherever that circulation needs to be, it won't be there anymore. So it's really important to kind of consider complications being wherever the body is exposed to this abnormal bloodstream, this abnormal amount of sugar.
Well, you talked briefly about back in the, long ago,
Yeah.
that how they determined whether or not you probably had diabetes was through urine. Frequent urination, I guess, was one of the symptoms. But what are some of the other symptoms that people can look out for? I know that typically it's hard.
Very
we
difficult.
go through so many things, especially as women.
Yes.
And but what are some of the things that you would probably tell some of our viewers?
Okay. Some of the things you have to look for is, first of all, look at your family to see what your family looks like. Ask questions to find out if anyone in the family has diabetes. Okay? Look at the way your family is shaped. And by looking at that, you're looking at whether they carry most of the weight in the trunk area and have very, very thin legs, or whether it's distributed so they're more pear-shaped, where the hips and the top of the body is more like an hourglass. Of those two, the apple shape is the worst shape you could have.
And when you say apple shape, I'm assuming, is that the one where you carry your weight?
Waist circumference. You got it. Because the waist circumference can really be a predictor that a person will develop diabetes.
Wow. Okay. Well, apples are good fruit, so I'm thinking, well, that's not that bad. No.
Pear's better.
But pear's better, huh?
Pear's better.
Oh, wow.
Pear's
wow.
better because you have thinness in that waistline. And that all has to do with where is the fat distribution.
Okay.
Is it distributed around organs or is it superficially distributed? When you see a person, I'm going to pick on the men, a man with a beard belly, it's really a predictor. And when that person or whether that person will develop diabetes. Now, that's another thing. So we're talking about symptoms. I'm talking about risk factors, and I'll go back and forth from risk factors to symptoms. So you're saying, what are some of the symptoms? The symptoms could be excessive urination, as we talked about. That's a driving force of the body trying to rid itself of extra sugar. So you're going to be urinating a lot more. But in that urine will be sugar. Okay? Then, if you're driving out all that fluid, the next thing would be you would have increased thirst. Why? Because the body is deleting itself of all this fluid by trying to get rid of the sugar and correct itself. Right? The next thing would be you would have a really, really increased appetite. And I mean, you could eat anything coming past you.
And it just wouldn't be sweets. You just wouldn't crave sweets. It would be anything?
It would be fluid, and it would be sugar, because in actuality, your body is craving what it's ridding itself of and what it's not being able to get. If the insulin is not working appropriately, then you can't get the glucose moving from in the bloodstream into the cells of the body. Therefore, the cells are starving while you have all this plenty that's in the bloodstream. I compare it to being in a warehouse, okay? You're in this warehouse surrounded by food. You're hungry as you can be. Everything is in the can. And for type 1, you don't have a can opener. But for type 2, you have a bottle opener. You still can't get to the food, right? You have it all around you, but you can't get to it. So if you want a comparison that you can really keep in your mind, that's one thing to think of. That you're in this food warehouse, the food is all there, but you can't get at it. One, because you don't have the utensil to get at it. The second, because it's the wrong utensil. Okay? So, you're going to be hungry. The next thing that could happen is you may have blurred vision. And your vision could be more blurry after you eat something. And the glucose level goes up. And that's generally because the sugar has to go someplace. So it goes into the lens of the eye. And it changes the liquefied part of the lens. So it becomes very cloudy. So you may get up in the morning and you can't see a thing. Then it clears up. Then you eat something and you can't see a thing. So blurred vision is one of those things as well. Some people complain of infections that keep repeating themselves. With women, it may be vaginal infections or yeast infections. With men, it may be a bladder infection that repeats itself. So these are important things to keep in mind. Now, the problem with these symptoms are, if you're over 40 and you get blurred vision, what are you going to think?
You need glasses. That you need glasses.
If you lose weight, what are you going to think? There's something that I need to do. So would that provoke you to go to a doctor?
No, it wouldn't.
Of all of those symptoms, what would provoke you to go to a doctor?
I don't think any of them would. I mean, literally, frequent urination is something that I know.
But a vaginal yeast infection would.
Okay.
Okay.
Well.
You would not sit on that for very long. Okay, so those are some of the things. You think about what's the driving force to push somebody to go to a doctor, but people would stay out there for a long time with these other subtle symptoms. Thus is the reason why when a person reports to a doctor for the first time for treatment of these symptoms, they've had diabetes for quite a while. Sometimes we don't see these people until they come into the emergency room with a heart attack or stroke, and that's the first symptom.
Well, you know, diabetes is often known as the silent killer.
Yes.
We're gonna wrap up this section, but tell me, why is it called the silent killer? I mean, there are some symptoms you talked about, but why do people categorize it as the silent killer?
Because it can be symptomless. Okay. And just because you have high blood sugars doesn't mean you're going to have a symptom, because your body accommodates those glucose levels. So you may not feel that something is wrong until you end up in the emergency room with a heart attack or stroke. Thus it's silent until something dramatic happens.
Well, I want to thank you, Michelle.
Sheldon-Rubio.
Sheldon-Rubio. I've seen it 100 times and still got it wrong when we came to the interview.
All right.
But I want to thank you. Your knowledge is just extraordinary. And we're going to have a second segment, and we're going to actually talk to a dietitian, Nancy Glacier, correct? And she's actually going to help us remake, guess what? Sweet potato pie. But I want you to tell people, how can they reach you? How can they reach the Diabetes Center?
Okay.
Web address, phone number.
Well, we're actually downtown Baltimore at the Joslin Diabetes Center, is located at University of Maryland in downtown Baltimore, but we're other places too. There are other sites that we have. We have a site called the Baltimore Washington Medical Center at the Baltimore Washington Medical Center, which is in Anne Arundel County. It used to be called North Arundel. We have another Joslin Center that's located at Maryland General Hospital, and that's in downtown Baltimore as well. And we also have one in Latham, I think it's called Latham, Maryland, and that's at Doctors Hospital. So we have a Joslin Diabetes Center at Doctors Hospital, outside of Washington. So there are many, many ways that you can get in touch with us. Our general number down here is 1-800-1888. I'm sorry, Joslin 8. 1-888.
And we'll also have the contact information on our website. You can log on to www.lovemybody.org. This is June Evans.